Hello there, welcome back to Plant and Animal Diseases class, and we're going to cover Unit 15 today, discussing diseases of the skin and extremities in animals, and we'll hit on some pretty common ones that I'm sure many of you are aware of. Let's talk pink eye first, and it's very common about any animal outside, cattle and sheep especially, and maybe surprising to some of you that it may cause this kind of difficulty, but when in fact it does, when you talk about severe stress from pink eye, can cause weight losses or slow weight gain down and production once it starts going through a herd. And it is somewhat contagious because mostly it's carried by flies that may feed off the eye secretions that are coming out of the infected eye. But certainly if it's allowed to persist and get really bad, it can cause severe blindness in animals where they basically will completely lose eyesight. You also see sometimes a cloudy speck will develop on the eyeball of the cow. Maybe they don't have complete blindness in an eyeball, but maybe see shadows or just see silhouettes or something like that, but don't necessarily lose full eyesight. If you get right on them and treat it with a veterinarian lots of times, or have a home remedy that you use or a product that you like to get through the store, they will recover, but often still harbor that problem that they garnered through. The cause usually is, again, bacterial in nature, but it can be viral, either one, and many times this is associated with IBR, or infectious bovine rhinotracheitis, that was covered earlier in the class. But that toxin, as it's secreted, irritates and erodes the covering on the cornea of the eye and causes that severe inflammation that many of you have seen. And generally we're talking about a warm weather type disease here, something late spring and then through the summertime. Obviously fly populations are associated with all of that, like we've said. But basically all animals are susceptible to this, but it tends to be the younger animals a bit more issues. When you see the clinical symptoms develop, oftentimes there's some swelling and sensitivity to the sunshine out there. An animal that's got infected with pink eye, they'll try and shade that eye from the sun as much as possible. Excessive tear production, and then the white erosion kind of begins on the cornea. And if it's untreated, that cornea, that eyeball, can actually fully rupture, then leaving them absolutely blind. Prevention really is very, very difficult. So your main battle points against pink eye problems is to control flies and other insects around the farm. And most of it is environmental. So if you keep your farm a bit more sanitary and have some kind of strategy against flies, you'll have a much better opportunity to knock down this problem on your farm. There are a few vaccination options out there in the marketplace and a few different treatment protocols, so make sure and contact your veterinarian and have good working relationship with them if this tends to be a problem. Although some will argue those vaccines are not very effective, personally I've used them and I feel like they have helped my particular animals at home. Treatment generally is antibiotic therapy, either in the eye or through an intramuscular injection that works, and I've seen vets go in with an injection of antibiotic actually right underneath the eyelid, right up into the eye socket, and that tends to knock it out pretty good. If you go with some kind of topical treatment, usually it needs to be done 2 to 3 times a day. If you have some kind of ointment or something that you spread on that eye, remember they're going to be producing a lot of tears and trying to wash that inflammation out, and so they'll wash out the medication as well. So a lot of it depends on the infection level of the herd, what strategy you choose. The next problem we'll talk about is foot rot here. And again, we're talking sheep or cattle, and though the diseases are similar in nature, they're quite unrelated. These foot rot issues can be acute problems, meaning very, very severe, quick onset, or a chronic problem that develops over a long period of time. Foot rot problems are always associated with some inflammation of the tissue within and around the foot, whether it's just above or can even spread up into the ankle if allowed to persist, and oftentimes causes some arthritis. I see some pictures here in a little bit that are pretty ugly, and if you've ever encountered foot rot issues before, most of them are pretty ugly, especially if allowed to go on and not get treated aggressively. But the cause generally is bacterial in nature. So again, here we're talking about some sanitation issues in order to try and help prevent, in your environment, keep your environment clean and free of manure and knock down the mud and things of that nature that might harbor these type of bacterial problems. Clinical symptoms, you'll see first off some swelling usually develop and probably some redness right above the hoof. Then you'll start to see some lameness develop. The animal will limp or favor that leg, that foot in particular. And then as it continues to rot, you'll actually smell the odor coming off of it. It's a moist necrosis type problem, so the tissue literally is, and you'll see the picture is pretty ugly here in a second. The tissue is quite literally rotting right off of the body as it goes there. And so obviously when we talk about that kind of severe damage, we're talking about irreparable arthritis and some chronic tendonitis issues. Prevention, like I said, improve your pasture and lot conditions, improve your barn sanitation strategies, anything to make it cleaner, keep those feet as much out of the nastiness as possible. And then the other opportunity is to provide a foot bath for your animals. Very common in the dairy business to have animals walking through a foot bath that maybe is treated with copper sulfate or even formaldehyde. There's some other things out there as well, but those would be the main two that helps treat that foot and knock down those problems and kill those diseases and bacteria off. The thing that you have to think about and remember when talking managing your foot bath, though, is you have to make sure and keep the water as clean as possible. You need to make sure that all animals get the opportunity to get all 4 feet into the foot bath and get it fully submerged in there. So that's lots of times you'll see the foot bath in the return lane from the milking parlor. But you can't just set up one foot bath for a whole, let's say, 300 cow herd to walk through because you're going to have to change the water. Otherwise, after a few turns, after a few head, that foot bath will be probably full of manure and nastiness and won't be that effective anymore. When you start to get a clinical case here, treatment obviously is warranted, and you probably need both a systemic and a local antibiotic are recommended here, and especially once you see some pretty severe symptoms start onsetting, you probably need both of those things. If you start to see just the inflammation developing at the top of the hoof, you maybe will go with something systemic or intramuscular with an antibiotic to help knock that back. If you have an open sore then developing, it needs cleaned and dressed, probably with a topical antibiotic on it. And then it's best to get that foot in a bath twice a day for a little while to help clean and dry and kill off that problem that's in there. So again, here's copper sulfate or even limestone is used, and I mentioned formaldehyde or formalin will help kill and dry that kill that bacteria off and dry the tissue out. That's the biggest thing, is we want to try and dry the tissue out as well as kill the bug that's harboring them. Picture, obviously this would be a very, very severe case of a cow foot that's basically you see no hoof at all remaining. Oftentimes this is the exception instead of the rule. You'll see one claw maybe what you see here you see this is much more common, where you see foot rot begin between the toes of the claw of the animal. And in order to get as severe as what the previous picture was, you probably find one toe that goes first and the other toe will be left behind. It tends to break out in one toe worse than the other. But imagine that 1,000 to 15 or 1,800 pound animal then trying to change how they stand. You cause a lot of different problems, because it's amazing how those animals balance on those little 8 toes, and if you take one of them away or one is injured, how much it will change how they stand and structurally how it affects them up into their hips, over their top line, and eventually you'll see breakdowns in locomotion severely due to those problems. A next related disease, and sometimes laminitis is confused with foot rot or used analogous to foot rot, and it is a separate problem. So make sure that we understand the differences, because laminitis affects cattle and horses, and certainly it could affect sheep and goats, but cattle and horses are the main two. So what happens is you find with laminitis a specific swelling of the laminae, which is the interior part of the hoof, and it's very sensitive tissues in there. So in cattle, we know that the cause generally is related nutritionally, and in fact 70% of the reported cases right now we know are related to feeding type issues, much more so than stress. Some other highly contributing factors include facilities. You say, well, how could facilities cause laminitis? Concrete that's in poor repair or poor condition, or even too new, surprisingly enough, can cause laminitis issues. Bad genetics issues can cause laminitis. Improper hygiene that we just talked about with regard to foot rot, and then simple animal behavior can cause laminitis. One of the things that we think is thought to be the leading cause with regard to the nutritional influence is actually related to the rumen. So rumen acidosis, when we experience that with your ruminant out there, that she gets drastically low levels of pH in her rumen due to vastly overfeeding grain, you can find then that will actually manifest itself as a problem not only in the rumen but also in the foot. And it'll soften that hoof tissue, soften the laminae, and causes the hoof wall and the foot bones to kind of break down, so to speak. And so that tends to then cause a very painful ulcer formation into the foot. We know that confinement production, freestall facilities, and lots more concrete has definitely increased the incidence of laminitis over the years in cattle, and increased wear and tear on the hoof wall, and much more pressure related to bruising. Clinical symptoms: when you find animals that have laminitis, they'll be very hesitant, very painful to walk, they'll limp, hang back from the herd, obviously. They'll cross their front legs. They may, you can often find they'll try and put pressure on a different toe in order to take the pressure off of that. Think about if any of you have ever had issues with maybe a smashed fingernail that gets really painful underneath there due to all the pressure that builds up from that bruise underneath your fingernail. That's just kind of the same thing that happens whenever you have an animal that has laminitis. Or another analogy that we could use is think about getting a blister on your foot. You'll attempt to walk in a different fashion in order to take the pressure off of that blister, and cows will do the same thing. And remember, we're talking a 1,500-pound cow potentially. Trying to take pressure off one of those little toes causes all kinds of other issues, and they'll actually sometimes walk like they're walking on eggshells if it's happening in more than one hoof at a time, more than one toe at a time. You also see what we call really abnormal growth patterns or hardship lines form in the hoof. The hoof should be nice and smooth for the most part, and if a cow has experienced a severe rumen acidosis event, sometimes you'll see a big groove in the foot, and you can basically trace that back how many days or months that may have occurred, because that hardship groove will have to grow out all the way from the skin line where the hoof is developing all the way down to the ground. So that will sometimes tell you what's going on. The other thing that the hoof claw will do is flatten and widen out, or what I call pancake, and kind of crack and break. And so instead of being nice hard hooves that you've seen before, you'll see those hooves kind of spread out and break down as that hoof tissue gets soft. And the last thing that you'll see is what we call sole ulcers, and that hoof will actually form a bleeding ulcer right inside that's very, very, very painful. And as you go and dig at that ulcer underneath on the bottom of the toe, you have to kind of dig that out and open that up so the pus can drain out of there. Preventative things that you can do is first off, nutritionally, make sure that we prevent clinical and subclinical ruminal acidosis problems. So monitor milk fat, body condition, peak milks, and you say, well, why milk fat? Well, whenever milk fat levels get depressed, that generally is a symptom of rumen acidosis or low rumen pH. So if your milk fat test is, let's say, running at an average of 3.75, and it all of a sudden drops to 3.2, you've probably got some rumen acidosis issues going on in your herd. So that is oftentimes one of the first telltale signs that you could be running some health issues. Feed more smaller meals per day, which is much less of an issue now than it used to be with our older feeding systems, but with TMR available basically 24 hours a day out there in the farm, you have much less chance for an animal to slug feed on a lot of grain. Increase your forage to concentrate ratio. If you think to animal nutrition class we talked about in dairy cattle especially, this should be somewhere between 40 or 45% forage all the way up to 60% forage in a typical confinement situation, or higher than that if you're talking about a grazing situation, with the relating then number being concentrate percentage. Lastly, check your trace mineral content in your feed, making sure that we're feeding enough zinc and a number of other trace minerals in there that help with hoof hardness, and include a B vitamin in there called biotin that also helps with. Improve cow comfort. Make sure that your stalls are nice and comfortable. Your concrete either isn't too pitted or too green or too slick that causes them to have footing issues out in the barn. And keep your feet trimmed on a regular basis. Cattle should have their feet trimmed probably twice a year is the best idea in terms of hoof maintenance for dairy cattle, in order to keep that hoof from growing too extensively long. I've literally seen animals that farms didn't invest in good hoof trimming services and had rumen acidosis issues on top of that. And now actually those toes will grow and look like elf shoes on cows, which is kind of funny to say, but boy, it really breaks down the quality of the animal's ability to walk, and reduces her locomotion scores and reduces her herd life. Treatment obviously occurs with some anti-inflammatory drugs, something that will help her deal with that inflammation there in the hoof. And then obviously we mentioned earlier we gotta attack that sole ulcer in the bottom, and what you can do is actually put a block on the good claw to help kind of get that bad one up out of the manure, so it doesn't get impacted with dirt and manure and things that might exacerbate the problem. And then lastly, good foot baths, which we've already mentioned. Horses, we also call this problem founder, and the couple main reasons that you might find this in horses is engorgement of grain. Somebody gets a little carried away feeding too much grain to your horse, and what happens is that, again, that problem manifests itself in the foot actually itself. You'll find again some swelling, and it'll start in the laminae interior of the foot itself, and so then you'll cause breakdown of that internal hoof tissue. The other thing that can begin to cause is incorrect or improper foot trimming. Throws that horse off balance, bruises the sole of the hoof, and so that horse again will try and compensate by putting weight, adjusting how he or she stands in order to get weight off of the affected area, and it will actually cause more problems in other areas. So sometimes this is pretty common following colic, that they'll colic, you kind of get them over that, and they'll found progress. Again, you'll see the appearance of walking on eggshells or difficulty standing in one position. If you actually check the pulse, you'll find an increased pulse rate to that foot as the body kind of responds with the white blood cells, and so trying to help relieve the inflammation that's going on there. And same thing that I mentioned in cattle is those horse hooves will kind of flatten and pancake out. They'll grow much too quickly as that hoof kind of softens, that hoof tissue softens. Preventative strategies here: proper nutrition. Keep the feed secure so that there's no way that a horse can kind of get into the barn or get into the feed alley area and just go to town eating extra feed or extra oats. Regular hoof trimming. We're talking, probably Again, twice, 3 times a year, something like that with horses, whatever your preference is, and then proper vaccination, deworming, and most of that is centered around decrease. Treatment, if you've got a horse that's foundered, and it depends on how severe it is, but I've actually, this is mentioned in a number of texts here, but also I've seen it where a producer will go and get a bucket of ice water, just like if you had a sprained ankle, in order to reduce that swelling. Stall rest with good bedding, get them off of the hard concrete if that's something that's causing an issue, and then work with your veterinarian and have a reputable, really good farrier in order to help prevent. A couple diagram things here that to show you. The upper left diagram is the outside is the hoof tissue, the little strands that you might see there that are connected to the outside hoof tissue are ligaments there that hold that triangle looking thing in the middle, which is actually the bone that comes down inside of the hoof. And what happens when you see animals that get laminitis is, if you go to the picture to the right, to the top right of the slide, is those tendons will start to loosen or even pull and break away. So what happens is that bone tissue will actually pull away and tilt and begin to poke at the bottom of the hoof, which if you've ever had a bone bruise, those are very, very painful whenever you get pressure and a bruise right on a bone. The same thing happens here with laminitis, is that bone. Notice how the distance between the bottom of the hoof and the bone has now decreased from the slide on the top left to the slide to the picture on the top right. So it actually increases the opportunity to then bruise that bone, which makes it very painful. On the bottom half of the slide, then you've seen where actually all of that tendon is torn away and that bone then drops down. It's not like it's broken away from the rest of the structural part of the foot, but actually, because we don't have those rubber band tendons there holding it up in place, that bone will drop down and be just below the surface of the bottom of the hoof. So again, increasing opportunity for that bone to be bruised, or increasing opportunity that if we have a sole ulcer develop in there, that actually you'll have an infection that kind of manifests itself in the bone. The other thing that I have seen happen is at the top right of the slide, you see that arrow kind of showing that the bone is tilting away. I've had hoof trimmers show me before a cow that's got laminitis in a hoof, and actually that bone can protrude right out the bottom of the sole of the hoof, and which you can imagine is exceedingly painful, and she'll do everything that she can to get her weight off of that toe. So you're talking about an animal that's nearly immobile at that point in time, because certainly putting pressure on an exposed bone would be extremely, extremely painful. Here's an example. If you look kind of starting at the bottom of the picture, going up the hoof, and if you see those grooves develop in this horse's hoof, those are what we call hardship grooves whenever that horse foundered. So you can see a number of them kind of going up the hoof line, and you can basically trace back again. We know that the speed of growth with on a horse hoof, you can kind of trace back to when the stressor occurred that caused that hardship groove in there. The next disease that I'm sure many of you are aware of is ringworm, that basically affects everything, and it's a zoonotic disease. So if you have ringworm out in your barn with your cattle or horses, you can certainly they can transmit it right to you, because it's a fungal infection on the skin, and like we say, it is quite it can go right through all of your barn to all of your animals. So cause we know is direct contact with infected animals, contaminated brushes, blankets, gates, bunks, stalls. It can be spread by lice. So there's a number of different ways that this occurs. We're pretty sure that it is harbored in wooden gate fences or wooden structures in your barn, and especially if you can't get them exposed to light where you can dehydrate and bake them out. Those things can survive for several years in sheds and barns and gates and etc., especially with animals that are kept in close quarters. It's most common in the wintertime, though. You'll see it outbreak in the spring and summer a little bit. Clinical symptoms, you'll see some lesions develop for about 3 weeks after the infection. That inflamed skin will cause these little pimples or blisters with vesicle formation on them. Then it'll turn kind of a scaly gray color and crust over. The patches are usually about a half an inch in size, but obviously many of them can be much, much larger than that. Most often found around the eyes, ears, neck, or tail. And you say, well, why particularly those areas? Because those are areas where animals will rub and scratch the most, or comes in contact with the feeding rail or the side of the barn most often. And so you see animals that will rub and itch and eventually lose hair off of those ringworm infested areas. Really, there's not a very good vaccine available for this, so it's basically just sanitation and disinfection that helps knock this problem down, and then keep your barn well ventilated and dry as best you can. In order to treat it, take clippers and clip the hair away from the infected area, kind of scrub it or brush it pretty aggressively. They won't necessarily like it, but try and scrub those scabs open with a brush and soapy water, and then spray it with iodine and spray it aggressively. The slide says every 3 days. I've done it sometimes twice a day, trying to aggressively kill and dry out that ringworm spot that's developing there. So if you want to keep this from really spreading aggressively on one animal or to many animals, you got to get aggressive with it in terms of treatment. You won't hurt the animal that much, but it'll be uncomfortable for them. But that iodine will dry that scaly, moist area out and do a pretty good job. There's a number of other things that you can use. I've seen people use like athlete's foot cream that's an antifungal. That sometimes will work. There's a number of different things. Don't forget though that if you do use a clippers or you do use a brush like it says here, don't forget to disinfect those things because if you happen to then forget and use that on another animal, you can spread the problem yourself. The next disease or problem that we'll discuss here is just very simple abscesses, which is a localized collection of pus. And we say, well, what might cause that? It might, maybe an animal fell or was ran into with something, or was getting up out of a stall and bumped itself on a stall divider, or slipped and hit themselves somewhere in the parlor, or whatever it might be. There's a number of different things that can cause these abscesses, and they can be hot or cold. Hot abscesses are very acute and they develop pus, so you've got an internal bruise that's then developing pus, and they're kind of very stinky or purulent whenever you open them up. The cold abscesses are somewhat chronic, and you get chronic pus accumulation due to repeated injury or repeated rubbing or something like that, and tissue disintegration within the area there. Those used to be much more common with stall barns and cows that were tied in tie stalls, in stalls that maybe weren't sized properly, didn't have enough bedding, or something like that, where they'd get hock lesions and things of that. Causes, we think that most of it is bacterial in nature, kind of as a response to being damaged. When we talk about abscesses in swine, we can get a lot of bacteria that can cause this particular symptom, and then enters through a skin wound somewhere and manifests itself. Depending on the size and location of these things, you can basically see no signs to very serious inflammation all the way to death if that thing gets infected and the animal goes septic, meaning the bacterial infection crosses into the blood and gets transmitted all the way through the body. They can get severely, severely ill. It can interfere with a lot of other bodily functions if they occur in the wrong place, right around the tail head or near the mammary system, or between the legs or something like that. These can be quite. Prevention, again, clean feed and facilities, comfortable stalls, properly sized handling facilities, things of that nature will help prevent these things. Also, aseptic treatment procedures, clean needles, clean tools, you'll keep abscesses from occurring as well. Treat the affected animals properly. is a good way to make sure that you'll keep these issues down. And if we talk about a recurring problem in swine, work with your veterinarian. Maybe you can go with a feed-grade antibiotic with a VFD, or maybe an oral vaccination, or maybe some injections. Put the injections in the neck rather than the ham because it's a less expensive cut of. Lancing, or basically taking a scalpel or knife and just cutting it open. You have to wait until they are soft. There's kind of a soft spot in them near the center and near the bottom where they will actually drain properly. You don't want to lance an abscess at the top and just open it up to where it will not drain out, because then actually you'll cause a bigger problem, because that pus will that site will seal up more and it'll kind of hold more contents than it will drain out. A great idea if you have a big abscess that's formed there is you can take a syringe with a needle on it and poke it in there and withdraw the plunger and see what comes out, because one of the things that you want to make sure that you do not do is open a bleeding hematoma. A hematoma is a big underskin bruise that develops that's actually bleeding actively, and as long as the skin keeps that contained, then they won't run as high a risk of actually bleeding out. If it's a bleeding hematoma, do not open it. Just leave it be. So you'll know it's bright red. In nature it looks like blood. It's not watery at all. That's a bleeding hematoma, and I would leave that one alone. If you don't get anything out, you might be careful. If you get something that looks like white or yellow pudding, vanilla pudding or something like that, then it's most likely a pus-filled abscess, and those you can generally open. But again, that pus should be smooth and viscous, yellow to white in color, and it will smell. So whenever you cut it open, don't stick your nose right down there or something like that. But lance it in a way, like I said earlier, that it will drain continually and keep clean. And then you can take a spray bottle of some kind, and actually, I've seen guys, and I've done it myself, take a water hose and spray it up in there, or spray bottle and spray it up in there and kind of wash it out, and then you can take some peroxide and clean that cavity out as well. Hematomas, I actually have lanced those after they've stopped bleeding, and we actually followed one a few days that had a bleeding hematoma and that stopped expanding, and so we knew that that tissue needed to get opened up, and so the vet and I we opened it one day and had big chunks of blood came out of that bruise area, but that was a bleeding hematoma. It's a good thing we didn't open it whenever it first was discovered. Probably a good idea, especially when we talk about summertime, is spray that thing with something for fly control, because you can get obviously all kinds of issues develop with that. So spray that on a regular basis to keep the fly pressure off of it, and then probably some antiseptic and antibiotic therapy right over the top of it if needed. Iodine or some kind of other antiseptic spray will be a great idea in order to help prevent further infection, because you have opened the skin and opened the body tissue up, which can then lead to further infection rate. Some take-home messages here. Remember that not all of these things are contagious, but still very costly in many different ways. If not leaving, certainly visible scars or problems that you don't want to deal with from a look of the animal's perspective. Those of you who show animals, certainly we don't want some of these problems developing, because then you can't get your animals off the farm. But from a profitability perspective and animal longevity, we can certainly impact negatively how long animals can stay in the herd and be productive and profitable for you. So be aggressive in preventing these particular problems, because the nice thing about lots of these is they absolutely are most all preventable or very treatable. So it's not like we have something that is going to cause great profitability losses if we're aggressive at taking care of them. So that's all we have for you here for Unit 15, Diseases and Skin Extremities. I hope this online lecture helps you in your assessment. Good luck.